prescription for special population. Here they have given three main common disorders as special population: diabetes mellitus, then coronary artery problems, and hypertension. They are given these three topics. So first to start with, we'll see about diabetes mellitus. It's a disease in which the body's ability to produce or respond to hormone insulin is impaired, resulting in abnormal metabolism of carbohydrate and elevated levels of glucose in the blood. So this will lead to the some other complications, some other physiological changes in our body. So this diabetes mellitus is quite common nowadays. To get rid of this, they are spending more money on their earnings. So to come out of this, what suggestions as a exercise therapist or physical educationist or nutritionist, what remedies can be suggested? We will see some of these things. Looking up to this diabetes mellitus, it is of two types: type 1 and type 2. Type 1 is also called insulin dependent. Type 2, that is due to the lack of secretion of insulin. So 72.9 million people are found to be suffering from this diabetes mellitus in India. So around 47.3 percentage of India's population is affected by this. So it may go up to more than 100 percentage. It will cross more than 100 percentage in the years of 2045. Some surveys say. So all these studies, they are going on studying this, and they are trying to rectify these problems. One more report by the National Program of Prevention and Control of Cancer, Diabetes, and Stroke. They have sold some vulnerable changes going to happen in the North Indian counterparts also. So it is said that Indian gets diabetic at a lower body weight, with around 20 to 20% of diabetes are being overweight. Among the group itself, 20 to 25% of overweight people are prone to diabetes mellitus. So what are all the symptoms for this? The main symptoms, especially they concentrate more on the type 2 diabetes. Type 1, the impairment of the gland itself is called type. Then impairment in the secretion is called type 2. Mainly they concentrate, mainly type 2 diabetes are prevalent among the people. What are all the symptoms for this? Increased thirst. How much water you are taking, it will be, you will not satisfy your thirst. So increased thirst will be there. When you are taking more water, frequent urination will be there. So diabetic patients, they will be urinating frequently because of the malfunctioning associated. This is one of the associated problems of diabetes mellitus, because of the malfunctioning of the kidneys. They have the feeling of frequent urination, extreme hunger. Whatever they eat, immediately after some half an hour or 1 hour, they will feel hungry. They cannot satisfy their hunger also. They will be always hungry. So extreme hunger will be there. Unexplained weight loss. At the age of, you can notice at the age of 40, people tend to become less weight. They tend to lose their weight. Their cheeks will go inside. So that physiology and physical appearance, the physical appearance will also be noted. So that we cannot explain why we are losing. Instead of going for any workout or anything, they will be losing their weight. though they are eating more, they'll be losing weight. So unexplained weight loss also is a symptom for this. Presence of ketones in the urine. Ketones are the byproduct of breakdown of muscle and fat that happens when there is not enough available. So when you are not secreting more, enough, when your body is not secreting enough amount of insulin, it will not break down. The metabolic process will be not proper, and because of this, the byproduct ketones will be there. The smell we can find by the smell of the urine or by the smell from their diabetics patient, they are sweating. So through sweat and urination, you can find out the smell of these. You can find out the number of ketones improving in their body. Then fatigue, they will easily get tired. Oh, though they are not doing any work or they are not involving in any physical activity, they will get fatigue easily. Then irritability, they will get the irritation in the foot, irritation in the palms, the irritation, they will get the irritation. Some they will get the irritation overall the body parts. So the irritability will be there. Blood vision will be blood. They can Blurred vision will be one among the symptoms of this diabetes mellitus. Slow healing sores, the soreness of the muscles, or some other injuries, open wounds. It will not heal easily. It will not heal faster. It will take more time because of the uh, insufficient coagulation of the blood. It will be taking more time to heal. Then frequent infections. They will be easily infected to some other allergens. They will get easily infected, and also frequent infections will be there in the young gums, particularly in the gums, and also skin. They will get a skin infection. For ladies, they will have vaginal infections also. They are prone to frequent infections because of this diabetes mellitus. What are all the risk factors which are increasing the chances of diabetes, the occurrence of diabetes? Family history of diabetes. If the parents or forefathers they are suffering from diabetes mellitus, they also will be prone to diabetes mellitus. So the family history of diabetes will also be one of the factor. Topographical factors. Topographical factors are African American, Hispanic, so Spanish speaking people, Native American, Asian American race, Pacific Islander, all these people may be prone to this diabetes mellitus. So because this is a topographical, they are still researchers are going on to find out the causes for this topographical occurrence of diabetes. Then being overweight. If you are overweight, if they are not able to spend the energy, spend the required amount of calories, the calorific value we have studied, if they are not able to spend the calories, health mantra we studied, input should be equal to output. If the output is less, they'll become overweight. So this overweight will be one among the reasons for becoming this occurring this diabetes mellitus. Then physical stress due to surgery or illness. The physical stress, they cannot move, they cannot go for any physical activities because of illness. They cannot spend much of their time in physical activities. They will not be mobilized. Mobilization will be restricted because of the physical stress. So since the mobilization is restricted, they are prone to diabetes. Use of certain medications. Most of the medicines, they have the steroids in it. So these steroids are causing some, they are becoming one of the reasons for diabetes mellitus. So some certain medications also will lead to diabetes. Injury to the pancreas. This is the main reason for the type 1 diabetes. Injury to the pancreas. Pancreas only is secreting this insulin. So injury to the pancreas also will lead to diabetes. This is the main reason for the type 1 diabetes, such as infection, tumor, surgery, or accident. Autoimmune disease. Autoimmune disease is, it's also coming under this malfunctioning of this uh, hormones. Immunity should be developed within our body, so that also will lead to the diabetes. High blood pressure. This is both high blood pressure and diabetes. They will go hand in hand. Those who are suffering from high blood pressure, they are more prone to diabetes. Those who suffer from diabetes are prone to high blood pressure. Abnormal blood cholesterol or triglycerides level. Abnormal blood cholesterol, the cholesterol which is insoluble cholesterol also will lead to diabetes because of the malfunctioning in the metabolic process. Age, according to the age, according to the increase of the age, they are prone to diabetes, because when they are doing aging, they will reduce the workload, they will reduce the physical activity, they will reduce the mobilization. So all these will also will be affecting the individual. They are prone to diabetes. Smoking, particularly smoking, it has some ill effects on hormones also. It Smoking will directly influence the metabolic process also. The metabolism will be reduced. Directly it will affect the taste buds also. The smoke, the nicotine and other things, other chemicals in the cigarette may affect the taste buds of the tongue. From the tongue itself, it starts working and it malfunctions many of the other processes like your digestive system and other system. This also will also influence in the occurrence of diabetes. History of gestational diabetes. Gestational diabetes means it is during the time of pregnancy. At the time of pregnancy, they will be develop the diabetes. The mother will develop the diabetes. It may have some impact on the child also. So this history of gestational diabetes also can prolong after the delivery. Also, it will be converted into type 2 diabetes, or otherwise the child, the mother who has got gestational diabetes will carry it over to the child also. Then what is the work of the insulin? Before that, what is the role of glucose? Glucose gives more energy to our body. The day-to-day activities, the daily living of the individual, everything is depending upon the glucose. The immediate source of energy from our body is from the glucose. So glucose comes from two major sources: food and the liver. Liver produces glucose. Food also, from the food the food is broken down, and from that we are getting the glucose, which gives energy. Sugar is absorbed into the bloodstream where it enters cells with the help of the insulin. With the help of the insulin only the glucose goes into the bloodstream. When your glucose levels are low, such as when you haven't eaten, the liver breaks down. The liver gives some amount of energy. When you are fasting, the liver will first, it will give the stored energy. It will give energy to all parts of the body. So like that, it will be going on. What is the work of insulin? Insulin, the pancreas secretes insulin into the bloodstream. The insulin circulates, enabling sugar to enter each and every cell. So each and every cell needs some energy for its functioning. So this insulin only circulates the sugar to all the cells of our body. Insulin lowers the amount of sugar in your bloodstream. So if it goes in the bloodstream, it may be going around and it should be absorbed by the cells. If the amount of sugar level is increased in the bloodstream, the cells cannot absorb. So insulin also lowers the amount of sugar in the bloodstream. When your blood sugar level drops, the secretion of insulin from your pancreas increases. It secretes more and it will give energy to the cells. So glucose we have already seen. So this glucose only is the energy giving product in our body. Then types already we discussed. Type 1, damaged insulin producing cells of the pancreas. So when the pancreas is affected, when the pancreas is hurt, it is called type 1 diabetes. When it is hurt, it will secrete less insulin or no insulin will be secreted from that. So for this, they go for insulin injections. So it is insulin dependent diabetes. Sugar cannot directly get into the body cells to give energy. So this insulin only will take the sugar into the parts of the body and also to the cells. Type 2 diabetes. It is also called adult onset diabetes. The pancreas makes insulin, but is either doesn't produce enough. Enough insulin is not produced, or the insulin produced is not working properly because of some other reasons, because of inactivity, because of delayed work, because of obesity, so because of the influence of all other hormones, it may not work properly. This is called type 2 diabetes. For this type 2 diabetes, only physical activity. We have to work out ourselves. We have to make ourselves work. We have to squeeze out the insulin to various parts of the body through the bloodstream. For that only the physical activity is essential. Then what are all the risk factors of type 1 diabetes? This is family history. According to when the parents or forefathers they are having diabetes, they also are prone to type 1 diabetes. Then environmental factors, topography we had studied earlier, like that the environmental factors also has some impact on the type 1 diabetes. The presence of damaged immune system because of other complications, some other complication. The autoimmune system may not be working properly. So this also may be one of the factors. Autoantibodies will not be produced in the body. This also may be one of the risk factor of the type 1 diabetes. Then topography, again coming back to this geographical area, topography, some countries like Finland and Sweden, they have high rate of type 1 diabetes because of the environmental conditions, because of the topographical arrangements, they are prone to type 1 diabetes. Then risk factors for type 2 diabetes. Main risk was overweight. The more fatty tissues, when the tissues, when the tissues have the fat cells, number of fat cells in large number, it will not go for proper metabolic process. So increase in weight is directly proportional to the occurrence of type 2 diabetes. Then inactivity. Less when you are less active, you are more prone to diabetes. So the input which you are taking should be spent for the whole day. The input should be spent within that particular day. So if your input is more, you are prone to diabetes. This inactivity will lead to the settlement of in the previous classes. I told you that the food which you are taking, the extra carbohydrate will be converted into adipose tissue and it will be settled down for some particular period of time. If it is not worked properly, if you are not working out properly, if you are not breaking the adipose tissue, that adipose tissue will again, it will be converted into fat and it will deposit in some parts of the body. So inactivity is also one of the risk factor for the type 2 diabetes. Then family history. It is hereditary. Those who are having the parents or forefathers, those who are having the diabetes, the children also are prone to diabetes. Then race of the people. Uh, Spanish, American Indians, they are also having the problem. Still studies are going on. Why the race is affected by diabetes? Still studies are going on. Maybe due to their climatical condition or some environmental conditions or some other reasons. They are still researching why the topography is related to diabetes. Then age. When you get older, you are prone to type 2 diabetes. Well, because when you are aging, you will reduce your activity. Some will not stop the intake. Some will not reduce the intake of food and other things, or some what you call some what kind of food they are taking, junk food, everything will also result in weight gain, which is directly proportional to the occurrence of diabetes. Then gestational diabetes, I already told you, during the time of pregnancy, the mothers will be eating more. They'll be having other some other what do you call hormonal changes also. Hormonal the system, hormonal changes, due to the hormonal changes also, they are all prone to the diabetes. So gestational diabetes also is one among the risk factor for diabetes. When it occurs, it may be prolonged as type 2 diabetes. After the delivery, it may be converted as type 2 diabetes. So they have to take care of all these gestational diabetes also when they are pregnant. Then polycystic ovary syndrome. This common in some women. PCOD, they call it as PCOD, polycystic ovarian disorders. So because of the hormonal imbalances, they will this syndrome will occur. This syndrome will also lead to diabetes. It's quite common among the PCOD patients. High blood pressure, as already we saw, high blood pressure is also directly proportional to the occurrence of type 2 diabetes. Abnormal cholesterol and triglycerides. Cholesterol, LDL, VLDL, triglycerides, it should be in optimum level. If it is more, if the good cholesterol itself is more, it also may give some diabetic problems. even though it is good cholesterol, which is soluble cholesterol, which will be directly converted into energy. Also, if it is more, if not, there is abnormal amount of cholesterol, it may also lead to type 2 diabetes. Risk factors for gestational diabetes. Age, particularly after the age of 25. They are given for women 18, for men 21. Now they have changed for women 21, men 23. Like that, they are going on changing the age for marriage. So women, those who are conceiving after the age of 25, are at risk of this gestational diabetes. So women, particularly women after the age of 25, the women getting pregnant after the age of 25, it is more common. Then family or personal history, family history, if their mother or grandmother, they are prone to gestational diabetes, this also like hereditary. It is hereditarily occur. Overweight. During the pregnancy, they will eat more, saying that everything we should go to the child directly. They'll eat more. This also will be maybe one among the reasons of gestational diabetes. They can take more sugar, biscuits. Now and then they have to eat, so they may take packets of biscuits. That also will be converted into sugar, and it will be causing the gestational diabetes. Then race. Again, coming back to this, topographical regions. Particularly, they say Spain, Spanish speaking people, Americans, and Asian people are getting diabetes when compared to other topographical areas. Then, what are all the complications of diabetes? What complication it may cause? First one, cardiovascular diseases. So, when the circulatory system is the energy, the required energy from the circulatory system, automatically the cardiovascular system, the circulatory system will be affected. So you are prone to cardiovascular disorders. Cardiovascular diseases can easily occur. Then nerve damages. This nerve damages is called neuropathy. Excess sugar level will injure the walls of the tiny blood vessels. That sugar will erodes the tiny vessels, walls of the vessels. The erosion will happen at it, and it may cause neuropathy. Kidney damage, nephropathy. Already we studied kidney, because of the damaged functional kidney, they get the frequent urination. So kidney damage may occur due to severe diabetic. Eye damage, retinopathy. So they will be having the problem of vision. They will have the blurred vision. It is very difficult for going for this surgery also. So specifically, retinopathy surgery will be. It is a different area. It is a different specialization. So the blood vessels of the retina will be affected because of the rupturement of the blood vessels to the retina. This retinopathy will be occurring. Then food damage. The flow of blood to the food will be reduced. The functioning, the neural function of the food also will be damaged, will be malfunctioning. So the nerve function, the other functions, corrosion of vessels, all these will due to the food damage. Sometimes they may go for amputations. They will have some cuts, they will have some wounds. It will not be healed. Prolonged healing process will lead to some other serious infections also. So once it is infected, the amputation, of fingers or amputation of the whole part of the limbs may be affected. So amputation is only the remedy for all these things for survival. So it may lead to the damage. Then skin conditions. They are more susceptible for skin problems because of the infections. They are prone to bacterial infection or fungal infection. Any infection may occur, so they will not be having the smooth skin. The skin will be affected. They will have some skin problems. Hearing impairment. Hearing problems are quite common among the diabetes person because all because of the improper circulation of nutrients to all parts of the body. So hearing, vision, all these are concerned mainly with the nervous system. So when the nervous system is affected, when the nerve cells are affected, when the walls of the nerve cells are affected, it will malfunction automatically. So they may have the hearing impact. Alzheimer's disease, Alzheimer's, they will forget themselves. They forget the past. All these things will happen because of the uh, malfunctioning of the nervous system. So this diabetics can also lead to Alzheimer's disease because of the poor blood blood sugar control. You're at the risk of these problems. Then depression, they will be depressed. They will not have the interest to reveal anything. They will be in a depressed condition because of this diabetes. They will not have the interest in eating. They will not have interest in work because of this uh, tiredness. They will not be interested in working. They will not be. They will be neglecting the course, household course. So they will be depressed. So depression is also one of the complications due to this diabetes. What are all the complications of gestational diabetes? Gestational diabetes, it's very complicated. They have to go for medication. Unless they go for medication, it may lead to fatal also. So they have to take care of the gestational diabetes. It should be attended properly. It should be medically attended. So what happens to, what are all the complications to the children? Excess growth of the children may occur. Excess growth of the children will lead to some C-sections. Normal delivery we cannot expect that the weight of the child will increase, the size of the child will increase. So this may lead to complicated delivery. So they may go for C-section, which is also further complicated. Low blood sugar level in their body, children. So inside the womb, the fetus will be having low blood sugar level, which also will lead to some other complications, some other physiological changes in their body. So when the blood sugar level is reduced, automatically they will be losing their energy. So it may be complicated. Immediately after birth, the production of insulin may be higher after coming out, if it after detaching from the umbilical cord. So this also will be a complication among the fetus. Type 2 diabetes later in the life. The mother will be having gestational diabetes. The child are prone to type 2 diabetes when they grow older. So this is one of the complications. This also may lead to death if it is not attended properly. If it is not medically attended, it may also lead to the death of the fetus inside the womb itself. So all these will be taken care of. What happens in the mother? Preeclampsia. Preeclampsia is reduced secretion of insulin. and also the impairment of the glands is called reasonableness. Subsequent gestational diabetes. Subsequent means first delivery. If they are getting the gestational diabetes in the first delivery, the consequent deliveries for the second child, third child, how many children they are getting, subsequent gestational diabetes they will be getting. They are prone to subsequent gestational diabetes. These are all the complications for the mother due to gestational diabetes. Then how to prevent? How to prevent the diabetes? Eat healthy food. Uh, Yesterday we studied about balanced diet, dietary, what do you call it, diet planning, everything is so eat healthy foods. If you eat healthy foods, you are preserving yourself from the occurrence of diabetes. So choose food lower in fat and calories. The calorific value should be less. The fat content should be less. If you take all these foods, you are not prone to diabetes easily. And at also the same time, uh, the fiber content should be more. The fiber content will be more, particularly in vegetables. So you can take more vegetables, fruits, that too, fiber, fibrous fruits. If you take, you can easily prevent the occurrence of diabetes. Get more physical activity. If you are idle, if you are inactive, you are prone to diabetes. So minimum 30 minutes moderate physical activity. If you are going for strenuous physical activity, you can reduce the time. Moderate physical activity, you can go for 30 minutes per day. It may reduce the occurrence of diabetes. Lose excess pounds. Don't ever go for overweight. If you go for overweight, again, from the overweight, you will lead to obesity only. So lose excess weight. When you eat good food, when you go for some parties, you have taken more. You spend it at the earliest before it is converted to adipose tissue or from adipose tissue to fat. Before it is converted and stored in your body, you spend the calories. It should not settle down in your body. So lose extra pounds of your body. It will reduce the risk of occurrence of diabetes. Then what are all the signs and symptoms? Already we have seen in the first itself, thirst, urination, extreme hunger. Okay. Apart from this, the dry mouth, unexplained weight loss we have seen, weak, tired feeling, numbness and tingling in hands and the feet, particularly the hands and the feet. They will have the what do you call it is like vibrating pain in the hands. They will get the numbness or tingling sensation in the hands and the feet. Slow healing source, dry and itchy skin, frequent yeast infections, all these infections. So we have already seen this sign and symptoms. Prevention, how to prevent the occurrence. Cut sugar and refined carbohydrates. Refined carbohydrates, the packed food. It is better to avoid the packed foods from your diet. Work out regularly. As we see, physical activity, you regularly work out. The workout should be, if it is moderate, it should be minimum of 30 minutes. So you have to work out properly. Drink water as your primary beverages. Instead of other beverages, instead of going for bottled drinks, you go for plain water. Drink more water. More water will hydrate yourself. It also will dilate the blood. It will be directly absorbed by the bloodstream. So take as much of water as you can. Lose weight. weight, you should work out properly. The health mantra, as I told you earlier, input should be equal to output. Whatever calorie intake is there, the calorie expenditure should be there in the same day itself. So you lose weight. If you didn't lose weight, then you are prone to overweight. If you are not able to control your overweight, you are pushed to the next category of obesity. So it is very difficult to come out from the obesity. So most of the obese population, they are getting diabetes. So overweight and obese population, they are getting quite, quite smoking. Smoking, we have seen throughout the study, we have seen smoking. So quit smoking. It many studies they have conducted on smoking, ill effects of smoking, and they have given it clearly. Smoking directly influences various systems of our body. So smoking, better you have to avoid smoking. Follow a very low carbohydrate diet. Carbohydrate, if the carbohydrate is more, it will be converted into what do you call adipose tissue, and the adipose tissue will settle down as fat. So very low carbohydrate diet should be taken. Then the portion sizes. The portion sizes. That is balanced diet. Whatever you need. Already we saw
Hour,
three is
or you can say 45 minutes to 1 hour, we are going to learn how do you record and how do you
allow. Okay. The portion sizes you have to watch carefully. Already we have seen 3 is to 2 is to 1. 3 portions of carbohydrate, 2 portions of protein, 1 portion of fat. Like that, you have to watch your proportion. Whichever is apt for you, you have to go for that. Accordingly, you have to take your intake. Avoid sedentary behaviors. Simply sitting and wailing away the time. Simply sitting in front of the TV. Simply sitting and watching the movies. Simply sitting and playing in the mobile or anything. So you avoid the sedentary behaviors. Whenever you get the time, whenever you get the chances, you get up and move, mobilize yourself. Don't sit idly in one place for more than 10 minutes, 10 to 15. You, if at all you want to change the channel also, you can get up and change the channels. Instead of using the remote, you can get up and change the channels. Like that, you practice. You have to practice your behavior. You have to modify your behavior. Avoid sedentary behaviors. Eat a high fiber diet. So vegan diet they usually call high fiber diet. So better go for vegan diet. Unless you have some parties, you can go for some hard food, some non-vegetarian food. So increase the intake of high fiber diet. Optimize the vitamin D levels. Various vitamins. Vitamins that mainly vitamins are helping us to helping us in the repair of the cells. Like protein, vitamins also helps in aiding the healing process. So vitamin levels also should be increased. Minimize your intake of processed food. Already we have seen the packed food should be minimized. Intake of packed food should be reduced. Drink coffee. Previously, we saw coffee and tea are ergogenic aids, but here for some studies says coffee and tea are good for the body. Many researchers they say that it may avoid taking tea or coffee may avoid the occurrence of diabetes. Some study they suggest. Maybe because of the uh, caffeine and other chemicals in coffee or tea, it may have some effect on the insulin. So they suggest to take some coffee, some amount of coffee or tea, that too black tea or black coffee. It is preferred than with the milk. Consider taking natural herbs. Natural herbs, so greens we have mostly avoided nowadays. So greens, most of the greens should be taken in our food. Natural herbs also will have direct effect on that. Mm, this turmeric. Turmeric has the property of healing. Turmeric, one kind of turmeric, curcumin, is good anti-inflammatory resource. So you can take this turmeric as in your food. Usually they in the night time also anti-inflammatory, like anti-inflammatory drug, they take turmeric powdered milk before the sleep. Like that, berberine is considered to be as a herb which the Chinese medicine they are using for thousands of years, which helps in the it helps as an anti-inflammatory herb. So all these things will be uh, useful for the prevention of diabetes. Then lifestyle modifications. How we can modify our lifestyle to avoid the occurrence of diabetes. Aerobic activity. First, you have to start with the aerobic activities. Aerobic activities, at least minutes per week. That is 2 hours 30 minutes a week. That can be split into 5 days or 3 days. So aerobic activities, continuous activities, aerobic activity with the help of, with the consumption of oxygen, we saw already. So we have to go for at least 2.5 hours per week. That can be split into 3 weeks with the intensity. If you want to go for intense workout, you can go for 3 days, or moderate workouts, you can go for 5 days. Instead of doing regularly, daily, you can split and you can go. So aerobic activity should be increased in your lifestyle. Strengthening exercises, muscle strengthening exercise. See, when you are not strengthening your muscles, when you are not doing any activity to your muscle, the muscle will start deteriorating. When you exercise your muscle, it will be increasing in size, it will be increasing the fibers also, the number of fibers also will be increasing. So you have to go for regular strengthening exercises to keep away yourself from the disorders or diseases. Flexibility exercises on daily basis. Some circulatory motion, some swinging motion, movement, all these will increase the flexibility of your body. So all these flexibility exercises will be included on a daily basis. Then these are all some of the activities and some tips for overcoming the diabetes. Aerobic activity, you can fix the duration, you can fix the intensity, you can fix the frequency, maybe 3 days or 5 days. Intensity, mild, moderate, severe. That intensity also you can set and you can overcome the occurrence of diabetes. Then we will move on to the next chapter. Hypertension. As we saw earlier, blood pressure exerted on the walls of the blood vessel is called blood pressure. So this blood pressure should be of optimum level. If it is more, it may lead to some other complications. So hypertension is otherwise called high blood pressure. So if the blood pressure is high, if the pressure to the walls of the blood vessels are high, it will lead to some other physiological problems. So it should not be there. Many reasons they are saying, where the reasons for blood pressure is the intake of food, from the intake of food, the psychological problems, everything they say numerous reasons for the pressure, blood pressure. Prevalence of blood pressure. High blood pressure may be linked to dementia. Dementia, loss of mm, thoughts, losing your memories. Loss of memory is called dementia. People, young people can have high blood pressure. Even the young, previously older people, after having some some complications, some health related issues, we got high blood pressure. But now it is prevalent among the younger generation also. It has no symptoms. BP, high BP has no symptom. You cannot easily identify the high blood pressure. Even those who are having high blood pressure, they don't know what is happening in their body. They don't know what ill effects it is giving. They don't know. So it is unknown to them. Women and minorities also face unique risk when it comes to the high blood pressure. Human deprived groups, they are also facing the same problem when they go for this blood pressure. This is quite common among all the groups of the people. Etiology, cause, to whom it will, according to the age. When you are growing older, you are prone to high blood pressure. Family history. If their parents or forefathers having blood pressure, the generation also will be prone to high blood pressure. Ethnic background. Here also the African American people have high risk of hypertension. So according to the ethnic group, they are getting for this also we are not able to find the correct reason why it is happening only to the particular group. Obesity and being overweight. This also is one among the factor for getting the hypertension. If you are prone to overweight or obesity, you are readily prone to hypertension. Physical inactivity. If you are not able to actively participate in any physical activity, you are prone to hypertension. If you are idle, if you are leading a sedentary life, you are more prone to the hypertension. Again, coming back to the smoking. See, this smoking will make the narrowness of the blood vessels. Because of the narrowness of the blood vessels, when the blood vessels are shrinked, the pressure will be exerted. Water flowing out of a bigger tube. There is difference between water flowing through a bigger tube and a smaller tube. So when the arteries and the capillaries shrink, when the blood vessels shrink, automatically the pressure increases. This is caused by smoking. The shrinkage of the vessels are caused by smoking. So it directly impacts hypertension. Alcohol intake. Excess of intake of alcohol also will also enhance the hypertension. The chemical in that liquor will directly have impact on other systems of the body also. Other hormonal changes will happen. So it will directly induce in the hypertension. Poor diet, not taking healthy diet. The main reason, major source, what our parents, our house members, our family members say is, if you take more salt, you are prone to hypertension. So diet also is very important. the diet, the constituents of the diet, components of the food are very important. So if you take poor diet, you are prone to hypertension. Saturated fat and trans fats. Saturated. Saturated fats, it's not giving the energy directly. It should be broken down and it's a long process. So saturated fats and trans fats also will lead to hypertension. High cholesterol, automatically in the level of fat increases, cholesterol level also increases. So it will directly influence in the hypertension. Stress, mental stress also will lead to some setbacks in our life, some setbacks, some what do you call some if you are cheated by someone or when you get mental stress, you are prone to this hypertension. Then excessive of stress, you will be expecting something, you will not getting it, you will be losing it. At that time, you will have the excess stress that also will lead to hypertension. Diabetes interrelated. When you have diabetes, you are prone to hypertension. When you have hypertension, you are easily prone to diabetes. So during the pregnancy, they will be having the anxiety. The mother will be having anxiety. So because of that, they may have some hypertension and also some other complications, some other hormonal changes also will lead to hypertension during the pregnancy. Apnea. Apnea is a disorder. So those who are suffering from apnea, they will forget to inhale. They will forget to respire. They will forget to inhale and exhale. So this will lead to the breathing problem in their sleepness. They will have the breathing difficulty. This also will lead to hypertension. Types of hypertension. Primary hypertension, it's also called essential hypertension. It is essential for everyone. When we are going to do any work, we will automatically we will have some tension. We will also have some fear. We will have anxiety. So automatically the physiological changes will vary in our body. So it is an essential hypertension. With this, we need to some extent. Then secondary hypertension is less common from the diseases that occur because of specific conditions. So sleep apnea, tumors, all will lead to kidney failure. All these things will lead to the secondary hypertension. Then malignant hypertension. This malignant, you cannot predict when it is happening. You cannot know when suddenly it will happen. So unknowingly, when they get tensed, when they get the stress, they'll get immediately, they will also immediately recover from this. Unknowingly, they will get it and they will recover immediately. Isolated systolic hypertension. This will not cause any desired effect. This will not cause any ill effects. This will be occurring. This is because of the aging process. Isolated systolic hypertension is related to the age. Mainly the old age people will have this hypertension because of insufficiency of food, because of the aversion of food, all these things. It may cause isolated systolic hypertension. White coat hypertension. White coat hypertension when you are going for some medical examination, the doctors and other clinical staff, they will be they will be with the white coat. Seeing them, you will get the fear. Normally, when you are entering the hospital, every your vital signs will be normal. Immediately, when you are asked to check some values, like blood pressure, pulse monitor, anything. If you want to check, immediately you will get the tension. That will lead to the variation in your vital measurements. This is called white coat hypertension. Last one, resistant hypertension. This resistant hypertension is due to the resistance of any drugs. They are used to the drugs. They are continuously, they are taking the drugs, continuously they are going for treatment. At some particular point, the drug will not work on them because of hypertension. So this is resistant hypertension. What are all the signs and symptoms of hypertension? Breathlessness. They feel difficult to breathe. The breath count will be reduced because of the tension, because of the high pressure of the blood. The breath count will be reduced. They will have the headache. Immediately they are prone to headache. They will have the headache, bleeding from the nose because of the reduced counts of the respiration, because of the increase in the heat of the body. They tend to bleed from the nose. So the pressure exerted from the arteries, it will come through the nose. Fatigue and sleepiness. Fatigue, immediately they will get tired. When they are getting the tension, they will get tired easily because of the faster circulation of the blood. They'll get tired easily and they'll feel sleepy. They'll be in a confused state. They'll be in a confused state. Tintin, uh, tinnitus or tinnitus, they call the different terms they will use. This is some ringing sound in the ears. This is quite common among the children because of their anxiety, level of anxiety. The school children, they will be getting this problem frequently. The ringing in the ears. They will not hear properly. They will not. They will not be in a position to understand what others are saying. This will also be causing this hypertension. The vomiting sensation. Automatically, because of the physiological changes in the body, you will be having the vomiting sensation. Profuse sweating. If you are in the air conditioned room or if you are standing under the fan also, the sweating won't stop. It will be going on sweating. The sweat won't stop because of the overheating of the body. Sweating will be not arrested. Profuse sweating will be there. Blood vision. At that time, you cannot see something. Your vision will be blurred. You cannot see anything clearly during the time of blood pressure, that is hypertension. So these are some of the sign and symptoms of hypertension. What are all the complications? This hypertension, it will directly affect the arteries. Since the pressure is more, the arteries may get affected. The inner walls of the arteries may be affected. The inner walls of the arteries will be ruptured. So damage to the arteries may happen because of this hypertension. Damage to heart. So the blood, when it is going with a greater pace with some unwanted heat, it may lead to the damage to the heart also. The heart walls of the heart will get affected. The inner walls of the heart may be affected. The functioning of the heart may be affected. So all these things may be due to the hypertension. Then damage to the brain. So this heart problem will also lead to the coronary artery problems, coronary heart problems also. Damage to the brain. The brain activity will be disturbed because of hypertension. So the supply to the brain, blood supply to the brain, the function that neural transmission to the brain, everything will be affected by the hypertension. Damage to the kidneys, function of kidneys to the dialysis process, the clearing out the waste, the absorbing the nutrients and clearing the waste, the water intake into the body, that also will be affected because of hypertension. Damage to the eyes also, the walls, the the nerves, retina, cells of the retina will be affected. The fluidity of the eyes will be affected. If the eyes will get the soreness, moisture of the eye will be reduced. All these problems may occur because of hypertension. Immediately, the core temperature of the body will increase, which leads in some other malfunctionings. Sexual dysfunctioning. This is not quite common. The erectile dysfunction, everything will happen accordingly because of hypertension. Those who are prone to hypertension, they will have all these dysfunctioning. Bone loss of bone. The uh, texture of the bone will be lost because of hypertension. The texture may be affected because of the excess supply of oxygenated blood. It will also corrode. The corrosion process also may happen in the bone, and it will directly impact on the bone. Trouble in sleeping, sweating, everything we have seen. So you will feel the difficulty in sleeping. If you lie down and if you want to sleep also, you are not able to sleep because of the temperature increase. You cannot lie down properly. So all these sleeping problems will be occurring because of hypertension. When you have to attend the high BP patients, what are all the emergencies conditions for the high BP patients? They'll lose their memory. When they are losing their memory, they change in their personality. They cannot understand what you say. They cannot concentrate what you are asking. They cannot concentrate who is with them. Then irritability or progressive loss of consciousness. They will collapse themselves. At that time, you have to take care of them. You have to immediately attend to the medical help. Then they are prone to stroke. Already we saw the nervous system will be affected. So the nervous system, the neurotransmitters will be affected, which will directly affect in the nervous system, and they are prone to the stroke. Severe damage to the body's main artery. The pure blood, it comes out, oxygenated blood will come out from the aorta. So the main artery will be disturbed. Severe damage will happen to the artery, main artery. That aortic wall will be having the problem. So that damage should be attended at the earliest. Otherwise, it will give more complication to the heart. Chest pain, they will have the chest pain. When they complained about the chest pain, immediately they should be attended. They should go for medical health. They are prone to heart attack. Chest pain, next stage, heart attack only. So those who are prone to heart attack, when they say they are having the pain in the chest, at that time you should be very careful and they should be taken to the hospital. It may lead to heart attack also. Sudden impaired pumping of the heart. The pumping action will not be in a rhythm. The rhythm of pumping of the heart will be lost, leading to fluid backup into the lungs, which results in the shortness of breath. See, many of the patients, they will have the diabetic patients, they will be isolated. After complication, they will be bedridden. They say that fluid is collected in the lungs, so they should not lie down. They should be in the slanting position only. They should not lie down on the bed. They should be elevated, and they should the chest should be up only, like that the doctors used to say, because the fluid will secrete inside the lungs. So this impaired function of the heart also will send back the fluid into the lungs, which directly affects the breath. Number of breath will be reduced. So that should be attended immediately. Sudden loss of kidney function, that we cannot identify or that cannot be known to others. They will have the cramp like feeling in the stomach, that also should be attended. Complications in the pregnant women. Pregnant women, already I told you, if they are not attended properly, gestational diabetes, they should, if they are not attended properly, the fetal death may occur, like that. Here also, when they are having high blood pressure, because pregnant women, they are prone to preeclampsia, that is the rupturement of the insulin uh, secretion. So they should be immediately attended by the medical help. How to prevent hypertension? Lose extra pounds. Overweight, you should not go to the overweight or the obese category. So lose extra pounds. Watch your waistline. Waistline just above the hip. That waistline should be watched properly. You should not allow fat to settle in your stomach. So the waistline should be monitored regularly. Belly you should not get. The belly should be reduced. Belly, you should not have the belly. Belly should be reduced. Exercise regularly. Regular exercise will help in prevention of hypertension. Eat a healthy diet. Again, coming back to this diet should be proper. Healthy diet should be taken. Diet with more fiber content should be taken. Reduce sodium in your diet. Already I told you, all the family members, they complained about the intake of salt. If you take more salt, you are prone to hypertension. So intake of salt should be reduced. Required amount of salt, optimum level of salt should be used in your food. Limit the amount of alcohol you drink. Better avoid alcohol. Instead of reducing the amount of alcohol, better avoid the alcohol. You are not living in a cold country. Your systems are adapted to the climatic conditions. So better avoid alcohol. Alcohol intake will also lead to hypertension. Quit smoking. Smoking also has the same effect. So smoking, at the earliest, smoking should be quitted. Cut back on caffeine. Caffeine was prescribed for diabetics, but here you have to cut back caffeine. You should not take caffeine or tea because it is considered to be an ergogenic aid. It has direct impact on the nervous system. So cut your coffee intake. If you cut your coffee or tea intake, the caffeine intake, you are not prone to hypertension. So to prevent hypertension, you have to reduce your caffeine intake or you have to cut off your caffeine intake. Reduce your stress. Whatever going to happen is let it happen. You cannot stop anything going out of your hands. So reduce your stress. Whatever problems comes, you have the courage to face the problem. You have plenty of solutions. So reduce your stress. That will lead to reduced hypertension. Monitor your blood pressure at home. Now many things are coming. Everything we can monitor from home itself. So blood pressure you have to monitor regularly at home. It is, though it is advisable or not, nowadays everybody is doing the same in the home itself. Previously, the geriatric patient used to monitor their blood pressure, sugar level, everything. But nowadays, in this sedentary lifestyle, in this busy world, everybody is doing this. So your blood pressure should be monitored regularly. Get support. Get support from others. You get support from your family members. You get support from your friends. Whatever you want to reveal, whatever you want to talk, whatever you want to share, you share with your friends or your family members. So get the support of them. Without other support, we cannot do any work. Without others' help, we cannot survive. So you have to get the support of others to get rid of your hypertension. Exercise prescription. What exercises you can do and regularly do to prevent hypertension? You can do your course, household activities like gardening. You can water the plants. You can clean your home. You can clean your garage. Weekly once you can clean your garage. You can go for mowing your lawn. So all these things, little act, you can make yourself active by involving in all these household chores. This will help you to relax yourself. At the same time, you will get the pleasure of doing something, some physical work for your own sake. At the same time, you are helping your house to be neat and clean. So household chores will help you in reducing your hypertension. Active sports, any game of your interest, whatever game you want to play, outdoor activities, not indoor games like chess or carrom, outdoor sports. You can play badminton, you can play football, you can play basketball, you can play volleyball, whatever game you're interested, you go out and play regularly. Climbing the stairs, instead of using the elevators, you climb up the stairs, climb down the stairs. That also will help you in reducing the pressure of your blood. So blood pressure can be reduced by climbing up and down instead of using the elevators. Walking, jogging, bicycling, swimming, dancing, all these activities, all these uh, physical activities help you in reducing the hypertension. You can prevent the occurrence of hypertension by involving in all these activities regularly: walking, jogging, swimming, dancing. Your core and as well as the whole part of whole body will be involved. Whole body will be involved in walking, whole body will be involved in jogging, the whole body will be involved in running, whole body will be involved in swimming, like the same in dancing also. Cycling, if you are not able to, if you have some problem in your knees, if you have some problems in your joints, you can better avoid swimming, dancing, or jogging. You can go for cycling. So all these things will help you in reducing your hypertension. Exercise approach. How to approach? immediately you should not go for high intensity exercises. First, you have to choose the volume of exercise. If you are going to play, if you are going to play basketball, it is a high intensity game. So you have to choose the volume of your exercise, how much you are going to spend on this basketball, how long you are going to play, in what intensity you are going to, whether you are going to play as a player, competitive player or recreational player. That should be first set by you. Or if you are going for jogging, how long you are going to go for the jog, whether it is 3 kilometers or 1.5 kilometers or 2 kilometers, that you have to choose the volume of exercise. Weight training, how long you are going to do the weight training, how many repetitions you are going to do, how much weights you are using. You can use 1 kg dumbbells or you can use 5 kg dumbbells. How many repetitions you are going to use, like that you set the target. Consult your doctor before going for any activity, any exercise. First, you consult your doctor. Without medical advice, you should not go for anything, including walking. If you are going for walk also, you have to consult your medical officer. Then keep it safe. Whatever activity you are doing, you be careful. You don't know to play basketball. First time you are entering the basketball court. You should know the rules and regulations. You should know the ability of the opponents, other players. So you should be safe. If you are not able to play with them, you better stand outside and watch. You choose some other game. So you have to make yourself safe. Weight training. You are going for weight training. You choose smaller weights. Don't directly go for bigger weights. Your first time you are going for outdoor activity. Instead of jog, you go for walk. Don't directly go for a jog. Even though you have consulted a doctor, you don't directly go for jog or run. You start from walking. You make yourself safe. Then you can go for other activities. From walking, you can improve to jogging. From jogging, you can improve to running. From running, you can directly go to swimming. Unless knowing swimming, you should not enter the. Doctor advised me to go for some aerobic activity. That too, so I'm having some giant stiffness and other problems. So I'm advised to go for swimming. Without knowing swimming, you are not supposed to. So you make yourself ready first. You safeguard yourself, then you involve in any of the physical activity. Monitor your progress. It is very important to monitor your progress. Why you are going for the physical activity? What purpose you have chosen this physical activity? That should be monitored. You want to reduce your weight. You monitor it properly. Whether the workout which I am doing is reducing my weight. Like that, you monitor your progress regularly. Then the principles of exercising: frequency, intensity, time, and type. Frequency. What frequency you are going to set? How long? How many days you are going to work out in a week? 3 days a week or 5 days a week? Intensity. How hard you are going to exercise? What intensity you are going to put up? Yesterday itself I told you 100 meters can be run in 12 seconds. At the same 100 meter can be run in 15 seconds. How much effort you are putting on that? That is the intensity. So you decide on your intensity. Time. How long you are going to work out? According to the frequency, you have to set the timing. Type. What type of activity? Whether it is a aerobic activity or weight training activity, that is strengthening activity, or long duration, game or sport. That should be decided by you. So this is the approach you have to take before going for any type of exercise. And obesity. They have given the other things in this approach. They have given some of the recommendations: frequency, intensity, time, type. They have given in the tabular columns. You go through that. So accordingly, you can do that. Some special precautions also they have given before going for this exercise. Precautionary measures you have to take before going for this professional organization. They have prescribed some of the things. They have given the they have given the chart indicating the intensity, type, time. When you are a beginner, how much intensity you have to, how much frequency you have to keep set. Like that, they have given some prescriptions for you. Then next, obesity. This is also coming under the special category population. Obesity is the next stage to overweight. So your body mass index. How to calculate the body mass index? It is the 18 kilograms divided by the square of height in meters. So if this value ranges between 25 and 29.9, or overweight. If it exceeds, if it is over 30 and over 30, you are said to be obese. So this is the body mass index now we are using. So according to the recommendations of ACSM, they are using this body mass index. So if your score is 30, or if it exceeds 30, you are prone to obese. So abnormal or excess of fat accumulation that presents a risk to health is called obesity. Abnormal excess fat, the fat which is stored in your body. You should not allow your fat to deposit in your body. Here they have given some facts about obesity. Consuming too many calories. The intake of calorie is more, you are prone to obesity. Leading a sedentary lifestyle. Instead of brisk physical activity, if you are not doing any physical activity, if you are idle, if you are sitting and working, they consider it to be the sedentary lifestyle. Not sleeping enough. If you have some problems, sleeping problems, or if you are skipping your time, that also will lead to obesity. Already I told you, rest is a must for our cells. So sleeping is the only rest we can attain. The cells can attain. So not sleeping enough also will lead to obesity. Lower rates of smoking. The smokers, if they quit smoking, immediately they will gain weight. Smoking directly affects all the systems I told you. First, it affects the taste buds in the tongue. So when you quit smoking, you will eat more. You will have the taste and you will eat more. So lower rates of smoking is also considered to be enhance obesity. Medications that make patients put on weight. Some medication, particularly I told you that the steroids which is included in the medicine will always make you the settlement of fat. It will make you obese. So at the younger adolescent age, when the children they are taking more medications, they are prone to this obesity problems. Etiology. What are all the causes for this obesity? First one, inactivity. If you are not active, if you are not participating in physical activity, you are prone to become obese. Then unhealthy diet rich in carbohydrate, diet rich in fat, diet rich in other this fat diets, we call it as fat diet. If you are taking unhealthy diet, and also if you are having eating habits, unhealthy eating habits. Unhealthy eating habits means previously they used to say, when you feel hungry, you have to eat. If you are not feeling hungry, you are not supposed to eat. But nowadays, what we are practicing, we are having 3 meals a day. We are practicing 3 meals a day: breakfast, lunch, and dinner. Previously, they used to say, unless you are hungry, you are not supposed to take anything. If you feel hungry only, you have to take, like that they were practiced. But nowadays, it is not like that. We have three. Some, those who are under some medical supervision or anything else, they are splitting under the diabetes or other patients, they are splitting it into 5. So unhealthy diet and also unhealthy eating habits also will lead to obesity. Genetical factor, it depends the genetical factors also. If the parents are obese, it is automatically the children also will have the obesity. So it is a genetical factor also. Family lifestyle. Now in this busy modern world, the family lifestyle is entirely changed. It the children tend to go out for eating only, not for anything else. If they are going for outing, they will finish off the outing with the sumptuous dinner. So the family lifestyle also will influence this obesity. Dinner in our particularly in when we are talk about Chennai, particularly Chennai, it is a hot humid place. So we should not go for heavy meal in the night. We have to take heavy only in the morning. Those who are in the cold area, those who are in the hilly places, they should have take more in the night. They should have uh, heavy meal in the night because their body should produce more heat to withstand the cold. But here we have to take more only in the morning. Breakfast should be very heavy. The morning meal should be heavy, but we are not doing that. Only night time we are going out and we are taking heavy meals. That is not advisable. This will lead to the immediately after taking the food also, we are not doing any physical activity. We are coming and we are sleeping. So the chance of the fat to settle down will be more. So family lifestyle also will lead to this. It will be one of the cause for the obesity. Some medical problems. Medical problems like Cushing syndrome, Prader-Willi syndrome. These syndromes. It is a disturbance to the system. that is not a disease, that is a disturbance to the system. This also will lead to these conditions, these medical conditions also will lead to obesity, improper functioning of the system, improper flow of blood, improper flow of other enzymes in the body will also lead to some of the obesity problems. Some medications, already we have discussed, some medications like steroids will be leading to this obesity. So the chicken which we are eating now will have direct effect on the obesity, because these chick they are grown up with the help of steroids, they say. Within a couple of weeks, it becomes bigger. The small chick becomes some 1 kg or 1.5 kg with the help of steroids, like that. They say. So because of this also, we are getting the obesity. See, some medicines for which they take for fits, stroke, all these things, antidepressant tablets, all these will have some effect on the systems and it may lead to the obesity. Social and economic issues. This is one of the greatest factor for obesity. Socioeconomic status of the parents. Socioeconomic status of the parents reflects on the children. The children tend to choose the costlier ones. They go for high calorie foods, everything. They can go for everything. They are approachable to the higher standard only. So on the socioeconomic status of the parents also will lead the children to obesity. Age is also a factor for obesity. So when you grow older, all systems will have the setback. They will also have the setback. So when you are in the aging process, you may be prone to obesity because of inactivity, because of your medical problems, because of your medications, or some other problems like diabetes and other things. You are prone to this obesity. Then pregnancy. During the pregnancy, all the family members will be influencing the mother to eat, and eat. Because you are eating for 2 lives, you are eating like that, they will be going on taking something else. Every time they will be taking food and it may lead to obesity. Then quitting smoking. Quitting smoking also, as I told you earlier, quitting smoking will enhance you to take more food. The taste buds will work. According to the taste, you will take more food and then also you will get the obesity. Then lack of sleep. Lack of sleep during the night will also lead to some other problems, some other physiological changes which will directly influence in the obesity. What are all the types of obesity? The types depends on different factors. First type, it depends on the area of fat deposit, the deposition of fat, where the fat is stored, where the fat is deposited. First one, peripheral. It is of 3 types. Peripheral area, peripheral accumulation of excess fat in the hips, buttocks and thighs, particularly back of the thighs. This is quite common among the women. The excess fat will store in the hips, buttocks, back side and back of the thigh. This is peripheral obesity. Central obesity. This is quite common among the male. It is accumulated in the abdominal area. Bulky male will be having bigger abdomen, stomach. Bigger abdomen they will be having. So this is the abdominal area, central. So combination of both peripheral and central. The fat deposit for men will be in the mainly in the abdominal area. For women, it is at the hips, sides of the hips, buttocks, lower abdominal area, and also the back of the thigh. So this is the type based on the area of fat deposition. Then the second type, association with other diseases. Type 1 and type 2. Association of other diseases like diabetes and other things, other coronary heart problems, other things. That is divided into two types, type 1 and type 2. So already I told you the input should be equal to output. When the input of energy is equal to the output of energy, you are not prone to obesity. So here type 1 obesity, it is not caused by any disease. It is due to the excessive intake of calories and lack of physical activity. You are taking more calories and you are not involving in any of the physical activities. This is considered to be type 1 obesity. Type 2, again, like hypothyroidism, PCOD, insulinemia, that is diabetes, and other internal secretion diseases, the hormonal disorders, other hormonal disorders. Because of all these things, because of hypothyroidism, PCOD, other this diabetes and hormonal disorders, obesity can occur. This obesity is considered to be type 2 obesity. Then the third category, size and number of fat cells. As we studied earlier, because of exercises, the number of cells, muscle cells will increase to a smaller extent. Like that, the fat cells also will increase in number and also will increase in size. According to the increase in size and number of the fat cells, it is divided into two types, adult type, child type. In this adult type, only the size of the fat cell will be increased. The size of the cells will increase. In child type, the number will increase. It is very difficult to reduce the number. It is somewhat, to some extent, we can work out, we can involve in regular physical activities, we can involve in some specific exercises to the particular area, and we can reduce the size of the fat cells. But it is very difficult to reduce the number of fat cells. So child obesity is very much dangerous. It should be taken care of at the earliest stages itself. It should not be prolonged. At the earliest, we have to find a remedy for the child type obesity. Then what are all the signs and symptoms of obesity? Dyspnea is nothing but the shortness of breath. Number of breath will be reduced because of obesity. Obese people can directly see when they walk, when they walk for a small distance, or when they climb a stairs, they will have the breathing difficulty. That is shortness of breath. Aching knees because of the weight, overweight. They are not able to. Knees are only the weight bearing joint. So they get the direct impact. The knee joints will get the direct impact of the whole weight when they mobilize themselves. They will have the pain. Some people they cannot walk. They will be having aching knees. Risk of hypertension or high blood pressure. So this is also related to the other problem. If you are obese, you are prone to hypertension or high blood pressure. Because of improper posture, the belly will be protruding outside. So the spinal curve will not be proper. You will not be having the good posture. Because of that, the back ache will be there. Back pain. You will be having the back pain because of obesity. Then some skin problems. Because of this obesity, you are prone to some skin problems also. You are because of the what do you call the metabolic processes, you will be having the skin problems, the hormonal changes. You'll have the skin problems. The bulky people, the obese people, they will have some scar like uh, under their neck, back of the neck, under the armpits. Like some areas you can see that black skin. That that is due to the hormonal disorders because of obesity. Then depression. The depression also is one among the symptom of obesity. Heartburn. They'll be having the burning sensation in the heart. They will frequently claim about the heartburns when they eat some junk food. Immediately they feel the heartburn and they will claim the heartburn because of that. Then snoring. When they go for sleep, they cannot sleep properly because of the excess weight increase. The uh, sleep apnea will be there at the same time because of the improper inhalation and exhalation. They will get the snoring. Then varicose vein. Varicose vein because of the malfunctioning of the blood vessels. They will have the varicose vein. It will be visible as fine thread-like structures in the legs. Blue or purple veins will be appearing in the legs, particularly the lower part of the leg, that calf, and it can be also visible in the thighs because of the malfunctioning of veins. The venous blood will not return properly. So they will get the varicose vein because of obesity. Irregular periods, it's quite common among the obese girls. The cycle will not be proper because of the malfunctioning of other hormones. Because of hormonal problems, they will not have the regular periods. Their cycle will be disturbed, so they will be affected by the irregular periods. Obese girls will be having the problem. Then, what are all the treatments for obesity? How it can how you can manage obesity? Instead of treatment, we can say it as how to manage obesity. Treatment process, only surgical and pharmacology can go for treatment process. How you can manage obesity? You can manage by reduced energy diets. So intake should be reduced. High energy carbohydrates should be avoided. High energetic fat products should be avoided. Particularly the canned foods and the stored foods should be avoided. Packed foods should be maybe avoided to get rid of these obesity problems. The main aim is to reduce the weight of the individual. After the normals, after the overweight only, they have come across this obesity. So the main aim is to reduce the weight. So to reduce the weight, the calorific value should be reduced. So reduced energy diets will help in management of the obesity. Then physical activity or exercise. You can involve in strenuous physical activities or exercise. So this physical activity, the time, type, everything should be taken consideration. Before going to the physical activity, you have to go for the consultation of the medical officer. Without the consent of the medical officer, you should not go for physical activity or any type of exercise. So you have to concentrate on this and you have to go for physical activity. Mild moderate will not be useful. You have to go for some strenuous physical activity only. That will only help you in your recovery from the obese state. Then behavior modification. Behavior modification, otherwise it is called behavioral therapy. So this is one among the important part. So automatically they will not be motivated. The obese people, they will not be motivated themselves. They will have some thoughts in their mind why we are. They will have automatically. They will have the stress level of stress should be reduced. They will be. They will not be treated as other individuals in the group, among the group. Socialization of the obese people will be very less. So the behavioral therapy will help them a lot in coming out of these conditions. So behavioral therapy is among the important therapies of this treatment, this obesity management. So we have to go for proper counseling. Then you have to involve in physical activity. Then pharmacotherapy. Pharmacotherapy without physical activity, without reducing the energy diets, without behavioral modification, it is not going to be useful. Only the medicines is not going to be useful. So all these will go hand in hand. This all should be practiced regularly. The final stage, surgery. Surgery is very complicated. We can never predict what will happen. So they will not be having only the obesity problem. They will be having some other hormonal problems also. So to get rid of this obese surgery, if you go for surgery, it will many celebrities also are going for this. They go for liposuction or something else like this. So they are not getting the fruitful effect, and also they are prone to a risk. So it is better avoidable. We can manage with the first four management or therapy. So reduce your energy intake, involve in regular physical activity, approach a correct counselor for behavior modification, and also proper medication should be taken by the obese people. All these will help in the management of obesity. Then exercise prescription. What exercises can we give? Increased physical, as I told you already, mild and moderate is not going to be useful. You have to go for some strenuous activity. Increased physical activity. Exercise, more exercise. Exercise should be specified. What type of exercise you have to do, that should not affect the exercise which you are doing, should not affect the other parts of your body. For example, you cannot go for a jog. With this obesity, you cannot go for a jog. You can go for a walk in the treadmill, or you can go for a walk in the outdoor settings. First start with jogging and walking, then you can increase the exercises. Then keep moving, don't be idle. Go on, keep on moving inside, whether you are in the indoor setup or outside setup, whether you are working indoor or working outdoor, you keep on moving. Cardiovascular exercises. You go for cardio instead of short duration activities. You better go for long duration activities. walk for miles. Like that, you go for cardiovascular activities. Then only your energy expense also will be there. That respiratory system also will get enhanced because of cardiovascular exercises. You set the frequency. It is better to go for 5 days instead of 3 days. It's better to go for 5 days. Intensity, it should suit your ability. You should not go for 90%, 80%, 70% like that. You should not go. It should suit your efficiency, your previous condition, your previous fitness level. All should be taken into consideration. Duration, how long you are going to do, that also should be consulted. So better go with the consultation of personal trainer. You are not going to do it of your own. If you are going, if unless you have your own knowledge, you should not go for on physical activities. You should not go of your own. So the duration, frequency, intensity, everything should be well designed. Then resistance exercises, all the resistance weight training exercises, or if you are not able to lift the free weights, or if you are not able to work with the machine weights, you go for resistance bands, resistance tubes are there. Like with that, you can go for it. Concentrate on the range of motion. Flexibility will be automatically, flexibility will be more because of the deposits of fat. So you have to work on the range of movement of your joints, particularly the joints. That should be taken care of. Behavior therapy. Behavior therapy, coming back to this, counseling and support groups. You should be within the support groups. You should not you should not rely on those who demotivate you. You have to be with the support groups, then only you can get better results. Okay, next chapter we can see later. So today I hope 2 hours over. Okay, I hope you all understand. Can we finish off the class?
Yes, sir.
Okay, okay, thank you.
Felix sir.
Okay.
Wilson sir, thank you.
Okay, welcome. Okay, okay, thank you, thank you all.
Oh, thank you, sir. Felix sir. Felix sir. Yeah, students please leave.
Thank you, ma'am.
Okay, okay, thank you. Thank you all.
Okay, thank you, ma'am.